Please like and subscribe for more tips and skills. Our CNA makes a mistake during this skill. Watch close to see if you can spot it. Our CNA skills video on nail care begins in Supplies needed for this skill are orange wood stick, emery board if needed, lotion, basin, soap, 2 washcloths, 2 towels, water thermometer, and gloves. Always remember your indirect care and safety tips prior to beginning a skill. Knock, introduce yourself, wash your hands, identify the patient, provide privacy, and explain procedure before beginning.
Hello, Mrs. Smith. I'm Markia, and I'll be providing care for you today. I'll be providing hand and nail care for you today. Is that okay? Next, I'll be providing privacy. Does this feel okay, Mrs. Smith?
It is.
Next, I'll be putting on my gloves. I'll be putting this under you. Now we'll be washing your hand. Next, I will apply soap. You go in front, palm, and in between your fingers, and under your nose. Next, I will rinse. Front, palm, in between your fingers, and under your nose. Next, I'll be cleaning under your nose. Does that feel okay?
That's fine.
So I'll be drying your hand. Next, I'll be applying lotion. Your front, palm, in between your fingers. I'll be patting dry excess lotion. I'm going to remove my dirty linen. Are you comfortable?
Yes.
Okay, I'm going to dispose of my supplies and remove my gloves. Okay, Ms. Smith, I'm going to lower your bed. And here's your spotlight. Is there anything else I can do for you?
No.
Okay, great.
Always remember your indirect care and safety tips when ending a skill. Make sure the patient's call light is within reach. Their bed is in a low position. Make sure they do not need anything else. Ask them for their preferences related to privacy. Wash your hands, remove soiled linen and trash, and place in the appropriate receptacles. Our CNA did great, but made a mistake. Did you spot it? That's correct. She placed soiled linen in her clean area. When washing, drying, and rinsing, you must always use a clean washcloth for each step. You may reuse your drying cloth to pat dry the excess lotion from the patient's hand. Please like and subscribe and follow us on Facebook and Instagram, or visit us at www.faithforwardacademy.com.